Hello, my name is Donella Fields. I am a Liberty University BSN student. My presentation today is Christian Leadership in Nursing. The role of the Christian nurse leader bears a heavy amount of responsibility. This nurse leader is not only responsible for mentoring, educating, and supporting others, but also is responsible for the way she represents Christ. Facing adversity daily, this individual must be strong in her faith, confident in their skills, and firm in their convictions. The nursing profession is forever growing, and new nurses emerge daily in our facilities. It is incumbent upon the nurse leaders to show the way and lead with a servant leadership mindset in place. A Christian nurse leader thinks of others first on a larger scale to improve best practices for all to enjoy and to adhere to, improving patient outcomes and safety. The nurse leader understands her role. It is deliberate in the delivery of her leadership style and the impact it will have on the staff and the nursing field as a whole. Ethical issues in the practice of leadership. There are a multitude of ethical issues within the leadership role. When leading, you need followers. Or as my friend John C. Maxwell would say, if you are leading and there is no one following you, you are simply taking a walk. In order to lead, you must have a realistic idea of what your position is as a leader so that you can lead well. Once you lead with your heart and not with your head, you will gain followers. People want to know your actions are for their greater good and that you hold yourself to a higher standard than to which you are holding them. There's no point in your actions speaking louder than your words if you are unable to deliver the behavior you expect from others. The application of moral and ethical behavior in a leadership position is evident in the leader's daily behavior. Having the ability to create goals that are attainable for you and your team is only the first step. Creating a culture in which everyone feels a part of is a whole other thing. Your staff and those you lead must feel as though they are part of something bigger than themselves, and that the jobs they do and the suggestions they make won't fall on deaf ears. Some of the other ethical issues in the practice of leadership include personal conflict. Eliminating any personal conflict you as the leader may have with your staff is paramount to creating that culture where people feel safe. It is unethical to perform discrimination. Providing the same opportunities for growth and the same opportunities for presenting their knowledge within your system is paramount. And also your behavior, eliminating HIPAA violations, showing your leadership team and your staff that you yourself do not violate any of the rules and do not perform any unethical behavior is a huge step for them to behave the same way. Response to external forces. Societal trends can both be of benefit and demise, depending on how they are approached. Applying team-building techniques such as visual boards can be a great asset in training, but they are also trending and may send the wrong message. One of the more obvious external forces is generating the income for your department and for the extracurricular activities you want to impart on your team to get everyone on the same page. Not to mention all of the equipment and standards you want to provide from the suggestions of those on the front line of your department. The staff needs to know what changes discussed will be implemented and aid in progress and the growth within your department. Teamwork allows for all parties involved to have a say in what happens. The leader susses out the best and most practical ideas and implements them, understanding that they themselves don't always have the best answers. Imagine yourself as a leader sitting around a conference table with 8 other people, and you are the only one that speaks, and you are the only one that comes up with suggestions, and you are the only one that implements them. How boring would that be for the other 7 people? You need to have a team dynamic approach where everybody on that team has a say and they can collectively come up with ideas that are potentially greater than you would have come up with on your own. Education is key to the success of any nurse. Providing a way for personal and professional growth for your team will only enhance their learning and their commitment to your department and facility. The nursing shortage we often experience can be slowed down or even stopped if the leadership team were to pour into the staff and make them feel valuable and appreciated. This is a large part of how a leader should behave and the emotions they should impart on their team. Self-care for nurses is another trend we need to see more of in the field. Allowing a space for decompression and forcing downtime, breaks, and lunch go a long way in a 12-hour shift. Having that dedicated space is a wonderful idea. However, if it's only effective if its use is encouraged. When discussing these societal factors, we must remember that the staff as a whole, they have another life we as leaders are not privy to. They may be suffering abuse at home, separation, divorce, chemical dependency, stress, isolation. It is so important for a nurse leader to provide a non-judgmental and qualified individual for the team to utilize in these situations to also help eliminate some of the hostility that may be found within the unit. When we look at other countries, they implement this type of behavior on a regular basis. For example, walk into a casualty or an emergency room in England and you have the lady walking around with her trolley offering tea and biscuits, newspapers and magazines to the family and to the patients in the casualty clinic. This gives a culture of we care about you, we understand that you're here, we're here to help you, and we're also here to kind of occupy you a little bit because we know that you're having a lengthy wait. Working in a department, I used to work in a very busy emergency room, and we had a decompression room. The decompression room was never used. It was never used because nobody had time to use the room. We need to make sure as nurse leaders we have somebody that is, the role for the day is to give breaks, allow people decompression, and to take care of the staff. That will help us go a long way when responding to our external forces. Let's talk about the impact of the nurse leader and how she differs from a Christian nurse leader. So what does differ between a Christian nurse leader and a non-Christian nurse? Christian nurses treat what we call the whole patient. This simply means that the Christian nurse doesn't just treat the medical condition or the immediate need, but they also include treating the patient's psychosocial needs, attitudes, and beliefs. None of this, however, doesn't mean a thing if you don't establish an open line of communication by discussing the communication preferences of the patient at the outset of care. The impact of nurse leaders on nursing staff includes satisfaction, retention, incivility, empowerment, and innovation, and the impact on patient outcomes includes safety culture and safe medication administration. When a patient comes into a busy emergency room, the very first thing that we see is the immediate assessment and the immediate need of that patient. Oftentimes what will happen is the nurses will stabilize the patient. Once the patient is stabilized, the insurance people will come in and ask questions. What is your spirituality? Are you Christian? Are you Buddhist? Are you etc.? That is the one and only time as a patient I've ever heard that question asked. What do they do with that information? Do they only impart that knowledge of my faith if I die, so that they know what to do with me and my body after I've died? What about during my care? You now know that I'm Christian. You know that I'm Baptist. You know that I believe this. When I'm lying there fearful, why isn't somebody having that conversation with me? Why isn't somebody comforting me through my Christianity and through my faith? The nurse, the Christian nurse leader, does just that, treating that whole patient, realizing that even though the body may have been helped, that the mind and the soul also needs the same level of attention. This does increase patient satisfaction. It increases staff retention. It empowers and innovates everybody in that realm. The nurse leaders, the nursing staff, the EMTs, the CNAs, the LPNs, all of the workers that make that building go around, the cleaning staff, everybody. You empower people when you behave in a manner that puts them first and you treat the whole individual and not just bits and pieces. And because you've treated a patient this way and your staff this way, but your patients, you are increasing your patient outcome. They have a better outcome because they are being treated for the whole patient. You also are increasing your safety, the culture around you, and the medication administration because you are feeding their belief, not just their body. Education of the leader. Education is incredibly important for all of us, not just leaders. The more we know, the more valuable our insight and input into a plethora of situations is best. A leader has a responsibility to not only remain educated, but to also stay ahead of the curve so they are able to impart their knowledge on the teams and to ensure the teams are up to date on the latest information possible. Having the mindset helps to create an environment for growth, learning, and enhances open communication between the staff members. Facilitate an organizational climate that empowers patient-centric, comprehensive healthcare through communicating best practice in nursing. 1 Timothy 4:12 states, "Command and teach these things. Don't let anyone look down on you because you are young, but set an example for the believers in speech, in conduct, in love, in faith, and in purity." According to the book of Timothy, a leader should not be a novice. A leader should ask themselves this: am I a seasoned, solid example for both insiders and outsiders? That's a great question. Am I a seasoned, solid example? If you are a novice, how can you lead others? Your lack of experience and maybe even your lack of education are of no benefit to anybody. If you want to leave, you make sure that you have those qualities. That will aid in the respect that you have of the people that you lead. In order for a leader to lead effectively, they must have the trust of those they lead. They can be done by holding themselves accountable and having the ability to confront those that fall away from their duties, responsibilities, and their faith. Leaders therefore must live to a higher standard than they set for others. John C. Maxwell says that leaders can't lead further than their own life. Leaders can't lead further than their own life. How true is that? What he's saying is that you can't lead with qualities you don't possess or with a lack of knowledge you should possess. Being authentic with yourself and others is a great start to determining if you are able to lead currently. Maxwell gives the following steps in his leadership Bible. Leaders are honest with themselves about their state. They cry out to God for renewal. They refuse to fake it. They want to model the truth for others. And they tell themselves the truth about the future. These are 4 great steps that leaders should follow and qualities that leaders should possess in order to lead effectively, efficiently, respectively, and appropriately. And finally, authentically me. I've been a John C. Maxwell leadership coach for several years and have implemented his great knowledge in my daily life. John once said to me and the other thousands at his seminar, "You don't know everything. Stop acting like you do." That really hit a chord with me, and I'm convinced he was talking to me directly. I was pretty confident that I did know everything, and no matter who I came into contact with, needed to know my advice in order for them to even begin to survive in this world. It sounds silly, but it was very true. I must have turned 12 shades of red when he spoke those words from sheer embarrassment. I knew the entire audience was looking directly at me. Those words changed my life and the way I practiced as a leader. I learned to listen, not just recognize when I was being spoken to, but to actively listen to what was being said. I also became very comfortable with that awkward silence moment, the one we always feel completely compelled to feel. What I learned from this was simple. When I didn't speak and just listened, I was able to really hear and take in what was being said. But it also gave me the opportunity to really think about what, if anything, I could add to the conversation. I actually became comfortable with not having to say anything at all. But here's the really strange thing. People began to ask me what I thought and solicited my words of wisdom. When I did choose to add to the conversation, the words I spoke were more relevant, effective, and about the other person. This led to even more people wanting to ask my advice. Essentially, what I did was build trust just by listening to others and not projecting my thoughts onto them, when all they were mostly doing is venting or sharing, not asking someone to interject. That was my opportunity for improvement and my one good thing. I went from falling short with the people I worked with to learning and growing. I even earned their respect and was able to provide a more sound leadership role. Integrity is a highly desired leadership trait. Authentic leaders reflect on their behavior and seek feedback about their actions affecting others. That is so true. And one of the other things that I found is when people were having a conversation and a discussion and I sat there and observed, not only was I not quick to jump in and say things that maybe weren't as relevant as they should be, but I had the time to sit back and reflect on what was being said, contemplate it myself, think it through, think the scenarios through, and I would just sit there. And when somebody actually asked my opinion, what I would then say was of more paramount importance and more relational to what they needed. And it made me a greater leader because I then had that servant leadership quality. It was no longer about me, it was about them. That is the difference between a Christian nurse and a regular nurse. We have to impart our abilities to understand faith and help the patients get through exactly what they need, when they need it, by putting them first. I hope that you enjoyed this presentation. I thank you so much for listening to me, and have a great day.